Hello everyone, it's Melissa Sweet, Public Health Journalist here from Croaky Blog. We are at the Lowitja conference in Melbourne, and here we've just come out of a wonderful session on the importance of early childhood, and I'll let our speakers introduce themselves.
Hi, I'm Donna Chee. I'm the Chief Executive Officer of the Central Australian Aboriginal Congress in Alice Springs, an Aboriginal Community Controlled Primary Healthcare Service.
I'm Megan Williams, a Senior Research Fellow at Western Sydney University.
Brilliant. And we just had such a strong presentation from you, Donna. Could you tell viewers a little bit about what you were talking about?
The key messaging was really about the importance of early childhood, and if we get the story right really early, then we can make a dramatic difference in Aboriginal people's lives going forward. So the critical period of development is from 0 to 3, and that's what the evidence is showing, and there are evidence-based programs that can assist with getting our kids onto a trajectory of doing really, really well in life.
You showed some graphs that had incredible gains for our young people in short spaces of time.
Absolutely, like in language development and cognitive development, but specifically in language development. So, you know, some really what you would think were basic sort of interventions around conversational reading, enriched caregiving, those sorts of things that I think we sort of take for granted but are actually really important in terms of a child's development.
And how do they fit in with the primary healthcare, comprehensive primary healthcare?
Well, it fits very beautifully in a comprehensive primary healthcare service, because what we have are those wraparound support services that are there for families and parents and mums and dads, as well as those for children. So in this particular program, our preschool readiness program, we were able to do child health checks and identify any, not just physical but or medical, but developmental areas that required attention. And so we put these kids into a 7-week program, and as a result of that program saw their language development improve by 6 months.
Was that the data that you reported in your brand new Medical Journal of Australia article?
Yes. And look, I think what that article is trying to demonstrate is the integrated child and family services approach that Congress has developed over many years. And the recent addition to that integrated service model is the funding recently by the Indigenous Health Division, thankfully, after many years of funding, lobbying to get this early childhood learning centre established. We're finally going to be able to start running that early next year, based on the evidence internationally on this program, but also the small study that I talked about in the conference today.
Based on many years of advocacy,
Absolutely.
lobbying, following up, fronting up, and the establishment of this centre is able to go ahead.
Yes, and although there has been in the last few years a focus by governments on early childhood, and there has been an investment put to it, the question is where is the money going and to what programs? Like, there needs to be some thought put into investing in those evidence-based programs that work, not just something that seems like a good idea to somebody, which is what I referred to in my talk about reckless innovation. But it should be innovation that is based on evidence, and that is what we try in an Aboriginal context and evaluate it, robustly evaluate it, so we can demonstrate that it either works or it doesn't. But given that it's worked somewhere else with some adaptation, which is what we've done with the Nurse Family Partnership Program, we've adapted that. and we've been running it. We're currently having it evaluated at the moment, but early signs of data that we're collecting has shown that that has been successfully applied in an Aboriginal context. So these programs that sort of come from nowhere with no evidence just because it's a good idea, it's just going to stop. It's really just using much needed resources in a way that's not going to make a difference in Aboriginal people's lives.
So you've collected your own data and been very active in generating your own evidence base. You've drawn on international evidence. The Boyer lectures were mentioned in your talk, and the Whitehall studies that you've drawn on. And do you have research partnerships as well?
Yeah, look, we've got a really robust research program at Congress. Our board is heavily involved in the decision making around research, and we've got MOUs with Menzies School of Health Research in the Northern Territory, as well as the University of South Australia, Baker IDI. So yeah, we see research as an important way of critical reflection, analysis, and building on what we've already got there and improving it in terms of services and programs for Aboriginal people in Central Australia.
So being here at the Lowitja Institute conference, I mean, you've been a long-term participant in Lowitja Institute business and...
Congress was actually a founding member of when it was called the Cooperative Research Centre into Aboriginal and Tropical Health. So I think it's been around for 20 years or so. So we've been there right from the beginning.
And where do you see us going in the future?
Lowitja?
And
Look, I think it's as Romley said at dinner last night on when he shared it with everyone, that they are starting. Lowitja is really starting to get a profile that is recognised just not in Australia but internationally among other Indigenous peoples around the world. So yeah, and this is having this first World Indigenous Health and Wellbeing Conference is a reflection of that. And I think we've had some fantastic keynote speakers, as well as concurrent sessions of local people across Australia, Aboriginal mob from all over Australia, as well as internationally. So I think it's been great.
Yeah, and across a whole range of topics too, from education, aspects of health, foot health, oral health.
Yeah, and but the sort of difference in this one, which was reflected even in the dinner last night, was the whole focus on Indigenous knowledge and culture. So even in the food, in what we were eating, it wasn't your standard Western foods. We were actually eating local,
experiencing that,
Aboriginal,
integrating
food.
that.
Yeah.
Now, of course, for Just Justice, I have to ask you about your comments that you made in your presentation about the link between early childhood and preventing young people ending up in juvenile detention, and just how you see...
Exactly. Look, if we get kids, get them ready for school, they have a good experience in school, they do well in school, we see more of our kids who then, go on to be lawyers, magistrates, not actually being in the detention centre but being on the other side. That's what this evidence shows, that if we get it right in the early years, and that's where we've got to invest, and we aren't investing as well as what we should, but where we are, I don't think we're actually investing it where what the evidence shows works. But we can actually keep our kids out of detention centres, and we certainly don't need another Royal Commission or another inquiry into why we've got high incarceration rates. We've had the Royal Commission on Aboriginal Deaths in Custody, we've had multiple inquiries, Senate inquiries, we've had sacred children's, little children a sacred report. I think what we need is a Royal Commission into why all these reports that have been done in Aboriginal affairs, what's actually happened with those recommendations. I think enough's enough. Aboriginal people, as far as I'm concerned, are sick and tired of being consulted, once again to say what we want done. It's about time government started listening and implementing what we've already said what works and what we think will make a difference in our lives and improve the lives of our children.
For Just Justice, we've gathered 90 articles from all around Australia showcasing and honouring the leadership of Aboriginal and Torres Strait Islander people, particularly in the criminal justice system, and preventing either incarceration in the first place or re-incarceration. And we really also are right there with you asking those questions about the accountability for government to implement the policies that they say they have on paper, that they say they will implement.
Yeah, it's just got to stop. We've got to stop locking Aboriginal people up and stop locking young people up. It's just absolutely unacceptable. It's not good enough in this day and age, and something's just got to be done about it. It really is.
What we see here is everybody embracing Aboriginal and Torres Strait Islander culture, whether it's from the food or from the presenters.
Absolutely, it's infiltrated right throughout the whole conference. It's really good. Yeah.
That's the way forward.
That's really fantastic. Just for people who are just joining us, can you just do a final sign off who you are, just for people who might have dropped in the middle of the conversation?
I'm Donna, Chee, CEO of Central Australian Aboriginal Congress and Aboriginal Community Controlled Primary Healthcare Service in Alice Springs.
And I'm Megan Williams, a Wiradjuri descendant. I'm a Senior Research Fellow at Western Sydney University and have been a member of the Just Justice campaign.
Thank you both very much.